So my first question to you is, previously we've talked about this shift that's been happening to digital health for really a couple of years. But obviously it's been accelerated by the advent of COVID-19. Can you talk a little bit about that generally and sort of in the context of your practice?
Certainly. So I'm also a practicing physician as well. I like being involved in the medical field because we can find opportunities where we can actually make a difference if anything has to be disrupted. But in terms of telemedicine and telehealth, the world has really gotten a wake-up call in how important telemedicine is as an industry. It wasn't like that just a couple of years ago, even a couple of months ago. We in the industry believed that there was a bit slower adoption with the consumer side of it. And even physicians and nurses had not been as quick to embrace it because our healthcare system basically has been entrenched in a see your patient type of a situation. And there are many obstacles that have been there for telemedicine to inhibit its rapid growth. But the pandemic changed all of that. And we've seen an uptick in telemedicine usage across the board, whether it's hospital systems or clinics like mine. And we were positioned in a very fortunate way to be able to assist with the pandemic by having this device right here called MedWand that allows physicians and nurses to examine patients across great distances.
And we also talked about a little bit about this last time, but let's talk about what you see as some of the prospects for digital health over the next couple of years. As you mentioned, we've seen this just dramatic explosion in telehealth visits versus in-person care. But how might other changes need to take place, changes in policy to accommodate digital health, things like reimbursement or how other technologies like 5G connectivity and that build out might, over several years, that might help digital health adoption?
It was well theorized in the telemedicine industry by people who play in it that telemedicine adoption was imminent, that it was eventually going to happen. And some of the obstacles that existed in the policy area. For instance, physician licensure is compartmentalized state to state. If I'm licensed in Nevada, I can't take care of a patient in Florida unless I'm also licensed in Florida, which is a long process. Some of those curtains have come down in telemedicine. In fact, the VA system was one of the first institutions to take down those iron curtains to allow physicians to practice state to state to take care of veterans who needed care. That's just one issue. We also believe that the speed of the internet, as it increased, would allow for better bandwidth to have video conferencing take place. And that has already been happening now for many years, but that's going to continue to happen as 5G comes into play and other aspects of technology that are enhanced just because of the way technology is, it keeps growing. That would also have helped telemedicine as well.